Amazing evening. If you are online, let's see you in the chat. Let's know where you are connecting us tonight. It's just time. We are not wasting time tonight. We are going straight. It's going to be an amazing evening. So if you are joining us on Facebook and YouTube, let's know in the chat where you are joining us from. As soon as we have, okay, someone has joined us. Please, are you connecting us from Facebook or YouTube? Let's know. We are starting right away. I know people will be connecting us later. We don't want to waste time tonight. It's going to be an amazing evening. Let's see you in the chat. We want to know, are you connecting us from Facebook or YouTube? You're welcome again tonight to another monthly BFM live stream. It's our monthly program where we bring different topics that relate to families. So you are welcome. Where are you connecting us from? We want to actually see that the chat box is working, because that's where you'll be sending your questions. If you're online, let's know those people that are online so that we start right away. Yes. Is it Facebook or YouTube? Please, before we start, I actually want to know, are you connecting us from Facebook or YouTube? And then where are you connecting us from? Can you send chat, please? I've not seen any chat yet. Okay. I think okay. Oh, sorry. I can see it now. Thank you very much from, okay. Oluwatoyin from Ogun State. Sister Magdalene from Birmingham. Okay, thank you from YouTube. All right, thank you very much. I can see it now. Sorry, my chat box was not working before, but I can see now. Please, that's where you put your questions as we start. So we are starting right away. Amazing evening, everyone. Good evening once again to another time, another impactful time on BFM live stream. And tonight, as you have seen, we are talking about men's sexual health. Questions that men are embarrassed to discuss, to talk about. We are discussing it tonight. We are shaking the table tonight. Health is wealth. We all know health is wealth. And we know even the Lord desired that our health prospers as our soul prospers. When you read 3 John 1, chapter 1, verse 2, he said, Beloved, I wish above all that your health prosper as your soul prospers. So the Lord desired that we enjoy wholesome health. So tonight we are talking about men's sexual health. Some questions that people are not able to come out to discuss. And now we have I'll call him Daddy. We have doctor in the house, Dr. Hosea Gana. I'm going to bring him on board now. Daddy is let me just give a brief description of doctor. He's a consultant urologist with many years of experience. He lives in UK. He's like a father I would say father in the Lord, and he's been a wonderful person since I met Daddy. We are so privileged to have him here tonight, and I know tonight is going to be amazing. So I'm bringing him on board. Please welcome doctor in the chat as he comes on board. Yes, welcome, sir.
Hello everyone.
Welcome, sir. Thank
Yeah,
God.
it's a
Yes,
pleasure
yes,
to be here.
yes. Thank you, thank you,
Yeah,
thank
thank
you.
you very much.
Thank you, sir. You are welcome. We are privileged to have you, sir. We are so privileged.
It's
We
okay. It's a pleasure for me too.
Thank you. So we'll go right to the questions. Tonight we are starting on a different note because we've had questions coming in. And I want to acknowledge the man that sent the list of questions. I hope we'll be able to finish it tonight. I just want to acknowledge him. Thank you very much, sir, from Coventry. I don't want to mention your name. I know you wouldn't like it. But we have had enough questions from that list and we are dealing with it right away. So, number one, sir, we
Yes.
want we are talking about number one thing I want to talk about, sir, tonight is this issue of premature ejaculation in men. You know,
Yeah.
some people they have it too early and some is too long. Oh, some you stay too long. Oh, some is too early. Is there any way to that? These are the issues that couples are facing in marriage. It's either it's too early, you ejaculate too early, or you stay too long on sex and it's no longer pleasurable.
Mm.
So let's start from that, sir.
Okay. So those things are, there are two things. The premature ejaculation is when the man comes too quickly, usually within 3 minutes. We say that is too short. Or primary ejaculation, premature ejaculation. So we can divide it into two: the premature ejaculation, primary and secondary.
Okay.
The primary one, that is all you know. Since you became sexually active, you come very quickly, usually within 1 minute. Okay. The secondary premature ejaculation, it wasn't like that. Things were all right, but somehow recently something has happened. I'm coming too quickly within 3 minutes. So that is premature ejaculation, coming too quickly.
Okay.
The other side you mentioned, we call delayed or prolonged ejaculation. And that too is not normal. Okay. And because it goes on, and as you rightly mentioned, the female partner now, it doesn't find it any more pleasurable. And perhaps she's hopefully has had her orgasm as well. So as far as she's concerned, things are now over, and she should be, the climax should be coming down. Let's start with the premature ejaculation.
Yes, sir.
A lot of this is psychological.
That's right.
Okay. And a lot to the primary premature ejaculation often to do with your first encounter, how it went. And generally, when you think of the population as a whole, people have sexual encounters quite early as teenagers.
Okay.
And I had a patient I know who, as a teenager, would visit his girlfriend in the girlfriend's house with the parents there. And they have sex, and he had to have it done very quickly before somebody comes through the door or whatever. Unfortunately, that was his first pattern and became the pattern going forward. That is psychological, get it over with very quickly. The secondary one, often something has happened, a life event has happened.
That's right.
Sometimes it can be because maybe the female partner has had surgery, a pelvic surgery, some other surgery. Something is just not quite right anymore. Maybe even like breast surgery.
Okay.
So the man wants to get it over with quickly. There is an issue there. So that is secondary premature ejaculation. A lot of the prolonged ejaculation may well be to do with medication in some people. But also not paying attention. If you are so busy, you are stressed. There are those who are able to have sex and be thinking about something else altogether.
Okay.
And when that happens, that is not right because you are not thinking about the relationship. This is part of the epitome of your intimacy together. So you need to give it your attention. You need to think about your partner. Unfortunately, some men think sex is for them and not for their female partner.
Wow.
But female partners are there to enjoy sex as well.
That's right.
And that is why both partners, the men have their ejaculation, which says, I'm done now. And then you climb, everything, dies down gradually. And the female has her orgasm, which says, yes, thank you, I'm done too. And gradually things relax. And after that, to maintain a good bond, you should have the time you're together. There are some partners who are unhappy as soon as one, usually the man finishes his up, is gone, or is fast asleep. No, spend a glow time together. for another 5, maybe 10 minutes, just to chill gradually together. That is important as well.
Thank you, sir.
I will now, if you want, I can now go about some of the treatment of premature ejaculation.
Yes, sir. Can you? Okay, sir. Because I actually want to say, how will a couple resolve this? But okay,
Okay.
go ahead,
Yeah.
sir.
Right. Okay. No. That question comes first.
Yes, sir.
How? First of all, you say you only resolve a problem. So somebody has to own up to the problem.
That's right.
Unfortunately, in my so many years of practice, men, when they come to see me because I have an interest in this area, sexual function generally, they come alone, which is not right, and it's not right.
It's all right.
Men, men are wired to try and solve problem quietly by themselves. We get the best outcome when the partner is there.
That's right.
When it comes to sexual dysfunction, I've actually had a female, a wife saying, I thought you were seeing somebody, that's why you didn't want to have sex with me anymore. That is very serious because that can lead to a dissolution of a marriage. So first of all, for the man to own up that I have a problem. And to let your wife know, even if first time around, say, honey, darling, I'm really sorry, but I have a problem.
That's right.
I come too quick. I can recognize that. And the good thing I found in my many, many years of practice is that women are generally very kind and very understanding. And when a man makes himself vulnerable in that situation, your partner, your wife will help you and will go everywhere with you so that together you can solve the problem.
That's right.
A problem aired is is half solved, they said.
Yes.
Once you own up to your wife that I have a problem, she's going to cooperate with you.
That's right.
Yeah.
Thank you so much, sir. Thank you very much. Please, you can put your questions in the chat. These questions have been sent earlier, but if you're online now, you have some concerns. Daddy is here to answer
Okay.
those questions.
Let me just mention briefly about some of the treatment that may
Okay, sir.
be required.
Okay.
A good one is psychosexual counseling, where you get a psychologist with an interest. You just go through your sexual history to begin to tease out what might be the problem. Like when I mentioned the teenage boy, his sexual encounter was with his teenage girlfriend, and he had to get it done very quickly,
Yes.
and that becomes a permanent problem.
Mm-hmm.
So that one, you can go through that and begin to talk about how to solve that.
Okay.
And the secondary one, perhaps everything has been all right, but maybe the wife has had a major surgery and their body image problems or something else. That too, the psychological counseling can help in that area. And whatever it is, even if you have medical treatment that can help, psychology is very important. And communication is supreme.
That's right.
And there may well come a time that sex is not possible or whatever it is. But when you communicate that, there are other areas you can show intimacy with your partner.
That's right.
So a medical treatment, we use two main things commonly. We do use medication used for depression, the SSSR, like paroxetine.
Okay.
So when those things are taken, they can delay
Ejaculation. Okay.
Yeah, we can use those. We can use a topical local anesthetic as well to reduce the sensation.
So, in summary, sir, these are solutions. Is
Yes,
either medical or psychological?
but there's also one which is quite important. I
Okay, sir.
want that. The way you have sex, right? If, for example, it takes you 10-15 minutes to start and finish, I want you to, if you try to now spend more time on foreplay, that can bring some satisfaction to your partner as well. You begin to understand, the erogenous zones in the woman to stimulate all of those. The breast has a lot of sensation. The lips, for example, the head and neck areas, to dwell more on those areas. And down below, The clitoris has a lot of innervation, and I will just mention that now, right from the beginning.
That's true.
The clitoris has about 10,000 nerve endings, much more than the tip of the penis. So that is a very, very sensitive area to play around with, bring in stimulation, perhaps begin to arouse your partner, your wife as well. So spend a lot of time on the arousal, on what happens before you actually penetrate. And after you penetrate, slow down. And you may want to come out and then go back in again and then come out. Anything. You may want to count the number of thrusts and think all the time, I am trying to pleasure my wife, not that I want it for myself. Yes, you do. And you can come anytime, but I want my wife to be satisfied. So your goal is for your wife to be satisfied. When you have a goal and you want to achieve it, you begin to have success. So maybe in the 1 minute or in the 3 minutes, your trust is not like 10. Today, say I will make it 15. Next time I'll make it 20. Begin to count. Man, you like your counting and things like that. And therefore your mind is on something. I've gone beyond 10. I'm at 15. And by the way, the average thrust is 500. So it's a long way to go.
Wow. This
Yeah.
is really sex talk that people will pay for. I remember I'm in a platform that they are planning this kind of talk and they said people should be paying. We are really privileged to have you, doctor. Thank you very much, sir. If you are online, you have some questions, put it in the chat. We are still discussing sex. And if you are just joining us, doctor has just explained premature ejaculation and taking too long, the causes and what can be done. We are so privileged to be here this evening. Sir, like I said, I just pray that we'll be able to touch few of the questions. There's this one I want us to, it's still related. Prostate and sexual performance. If a man has been diagnosed with prostate, does it affect sex? Or can such man still have sex? What's the relationship, sir, between prostate and sexual performance?
The answer is no. It does not affect sex directly.
Okay.
And that means cancer or no cancer before treatment. Okay, we're at the level of diagnosis.
Okay.
Now, when there is an enlargement of prostate, the only thing it can do to affect sexual function is there is reduced ejaculation, there's reduced semen.
Okay.
Okay, but it does not affect erection, the hardness of the penis at all.
Okay.
That will remain at your level, whatever your level is. Maybe because the enlargement of the prostate affects older men, and so maybe at this stage already you are beginning to have problems with sexual performance because it's also the age of the enlargement of the prostate. Okay. But you should be able to get what is normal for you erection. Okay.
So it doesn't affect erection.
However, I think I don't know if you want me to talk about this. Treatment of enlarged prostate, whether cancer or not, can have an effect on erectile dysfunction or erectile function.
Okay.
While we're here, let me just mention that so we don't have to come back anyway. Yes. So the enlarged prostate does not affect your erection.
Okay.
It may affect the quantity of the semen that comes out at the time of ejaculation. It is reduced, or maybe nothing is coming out because the prostate has enlarged and is pressing on the inside, the tube, the urethral tube where the urine comes through. So it can affect that. But when it comes to the treatment of an enlarged prostate, and I want to start with the benign, non-cancer, there is no cancer, it's just simple enlargement. First of all, we can say lifestyle, don't drink at night and all those kind of things. Don't take caffeinated drinks. They make it harder for you to pass urine. But some of we use two types of medication. One is to shrink the prostate. The one that is used to shrink the prostate works on your testosterone. And it can reduce the quality, not the quantity, the quality of your testosterone.
Okay.
And some men may have difficulty with libido and erection because of that medication. About 5 to 10% may have that problem because they are on that.
Okay.
There's another medication that relaxes and opens the process so that the urine will come out better.
Okay.
This one can cause issues with ejaculation. We call this dry ejaculation or retrograde ejaculation. So when a man has sex, the semen that comes out is much reduced or nothing at all. So
Okay.
those are the two ways the medical treatment tablets you take
All right.
can affect for benign prostate. And let me just carry on. I'll finish very quickly.
All right, sir.
Now, if you need surgery on your prostate, there are various types of surgery that can be done these days, from what we call minimally invasive surgery that doesn't interfere with your erection and does not interfere with your ejaculation.
Okay.
If you ever need prostate surgery, speak to your doctor or to the specialist. Is
That's
there anyone that does not interfere with your erection? There are surgeries that are available.
okay.
There are some surgeries that will interfere with your ejaculation, give you a dry ejaculation.
Okay. Okay.
Other types of surgery can cause a bit of damage to your nerve of erection. Therefore, you may not be able to have erection after that surgery. So these days, when you go for treatment, ask the specialist. There are various types of ways to treat. Surgery, no surgery at all. There are just many different ways. And our people, generally Black people, tend to have very large prostate at an earlier age than non-Black people.
Okay.
And therefore, it's worth your while, if you want to preserve your sexual function, to talk about it. If you live in the United Kingdom or the US, places like that, there are now, half a dozen different types of ways to manage your prostate with a surgery without you losing your
Okay.
sexual function.
That's
And I mentioned quickly, when it comes to cancer of the prostate, where the prostate, there are two things: either you cut it out completely or you use radiotherapy. Those can damage the nerves that give you erection.
okay.
So there is an incidence of erectile dysfunction, and ask the surgeon when you are being considered or your loved one. And I want to say this for the women. Often women will keep quiet when all this consultation, but please be upfront.
That's
Sexual
right.
function is for both the man and the woman.
That's right.
Please. So ask, write your questions down at home and read them through one by one. What are the side effects of this? What is the sexual function
That's
of
right.
this? And then you should be able to discuss that with your doctor.
Yes, sir. Thank you very much. Like I said, I'm expecting men online to put their questions there. Okay, thank you. I'm seeing some questions now. I'll put it on. Like I
Okay.
said, we are shaking the table tonight on this issue of men's sexual performance. Women have kept quiet for long. Sex is for both men and women. And thank God we have doctor in the house who has had experience in this line and is free to talk to us about it, to give us confidence to talk about it. Even after today, you can speak to your doctor, your concern. Don't keep quiet there. Sex is meant to be enjoyed between husband and wife. Sex is fun. Now, going back to weak erection, because sir, most of these things we hear from counseling, it has to do with not having sexual satisfaction, and there are various reasons. Now, about weak erection, I want to talk about this. I want us to this issue of Viagra. We had this notion about it that, oh, it's not okay, and I heard recently that at times it's safe. How safe is Viagra to treat weak erection, sir?
Very safe.
Very safe. Are you
Yeah.
hearing that? Because some of us from Africa, once we hear Viagra, anyway, we didn't have enough education then. It's a different perspective.
Okay. So Viagra was researched to treat heart conditions.
Hmm.
So those who have angina, when the artery to the heart is getting blocked, they were trying to find a medication that will open up the artery to the heart, so they don't get angina, that can lead to a heart attack. It
Okay.
didn't work very well, but the men who are trying it didn't want to stop when the research came to an end, because they were getting good erection.
Wow. Okay.
Okay,
Okay.
that is the
All right.
story of Viagra. Now, there are contraindications. There are people who cannot or should not take Viagra.
Mm.
So if you have a heart condition and you have to have the spray, the spray in the tongue,
Mm.
when you have a angina, a pain on your heart, especially the left side, we
Yes.
don't want you to take Viagra because you can get double dose. If
Mm.
you remember, as I just mentioned, his history was to open up the blood vessels of the heart. So
Mm.
if you have just had a stroke within the 6 months or thereabout, you had a heart attack, you are on GTN, any spray under your tongue to make the arteries of your heart, those two people should not take Viagra. Anyone
Okay.
and everyone else, it is safe, except if you have some side effect we don't know about.
Okay. Thank you, sir. I think, in
So that
fact,
is
okay.
Viagra, and there are others. Many there is tadalafil or Cialis and all of those, and they work very well.
Yeah, that's
Now,
fine.
if you live in the United Kingdom, your GP is only allowed to give you 4 tablets a month, 4 tablets in 4 weeks, which, as a specialist in the hospital for me, that is not enough. You need to take it on a regular basis. So if you are on Viagra, and many people stop taking it because they say it hasn't worked. You need to go and these days get some more for yourself. It is now cheaper
Mm.
than what it used to be. You can get it off the counter just
You
like that.
see? You see?
You don't need a prescription.
Mm.
So if you're on Viagra or Cialis, Sildenafil, all of those things, I want you to take them like every 2 days, even when you don't want to have sex. The idea, naturally, a normal person, a 20-year-old man gets erection every morning, for
Mm.
example. But if you are unfortunate now and you don't get erection, you have erectile dysfunction now, by taking the Viagra on a regular basis, even when you don't want to have sex, it allows blood to flow to your penis and then
Wow.
give you the spontaneous erection, even though you don't want to have sex.
Okay,
And
sir.
that makes men feel good. The
Mm.
fact that in the afternoon they fall asleep or something, they wake up, there's an erection, it
Ration.
makes you feel good that when the time is right, I will be able to perform. This is a psychology part of the Viagra and similar medications.
That's
So
true.
just don't take one and think everything might be okay. Get some more. Try it on a regular basis. Try something different. And there are many
Wow.
medications out there.
Wow, thank you, sir. I hope you are enjoying this talk. Hey, men's sexual health. Thank you. Questions men are embarrassed to ask about. We are still on it. If you are joining us online, we have some questions now, sir. Can bilateral varicolectomy surgery affect erection?
No.
That's right.
So varicocelectomy is a varicose veins of the testes.
Okay.
That's what it means. You can have excess veins in all parts of the body, but usually the common ones are in the legs. Many people you are aware of it. Some of you might have had surgery, or your aunties, your parents, or somebody would have had surgery for varicose veins.
Okay.
The principle is the same. It is not desirable around the testes.
Okay.
The men's testes are hanging outside, unlike the ovaries that are inside, so that they have a lower temperature to produce sperm. That's why men have testes outside.
Okay. Okay.
So when there is a varicocele, it raises the temperature around the testes.
Okay.
And therefore, this reduces the quality and quantity of sperm produced and can lead to infertility.
All right.
And
Thank.
that's why it's desirable to have it treated, especially as soon as possible in teenagers. I treat this in some teenagers these days,
Mm.
so as to allow the testes to develop to a full size and therefore produce a good quantity and quality of semen.
Thank you, sir. This is
Yeah,
really
but
very.
it does not. You see, it does not. It's not near the nerves of your erection. It is
Mm.
not near
That's right.
your penis whatsoever. It has nothing to do with that. But this is where psychology comes in. Men have had their gallbladder surgery done and say they cannot have erection.
Mm.
It has nothing to do. Your gallbladder is right up almost near your chest. But afterwards, some people say they cannot have erection
That's right.
because there's a psychological aspect
Aspect of it. Okay.
as well.
Okay, sir. We are moving on. I believe you know this program is for all. So you share the link, share this information to others. Anyway, it's recorded on our YouTube. Now, another question, doctor. Sir, does prostate enlargement medicine affect erection?
I mentioned that earlier on. So the one called finasteride or dutasteride, or sometimes you can combine that. can affect erection in up to 10% of men. Yeah. So there is one called finasteride. Normally, the dose of the the finasteride is 5 milligrams daily,
Okay.
if you to know which is which. And then there is the one called tamsulosin, which is 400. So if you see the 400, it should not affect your erection, but it may affect your ejaculation.
All right.
But the dutasteride and the finasteride, because it is playing with your testosterone, you can lose your libido in
That's
up to that percentage.
okay. Talking about sexual libido, but I want you to answer this question. I'll go back to this issue of low sexual libido in men and women. This question, sir, it says, please, doctor, why are black men mostly affected with prostate? Does it have to do with circumcision?
No,
No. Oh, I don't
no,
know.
no. Black men, no, but black men unfortunately tends to have bigger prostates at an earlier age.
Hmm.
And unfortunately, too, black men have more prostate cancer.
Hmm.
In the West, white people, 1 in 8 white men will get prostate cancer.
Hmm.
But 1 in 4 black men will get prostate cancer.
Hmm. That's right.
So while we're on it, if there's a history, or maybe there's no history, if there's a history of breast cancer in your family, prostate cancer in your family, a black man should get checked before they are 50.
Hmm.
Please go and have a checkup. And if your GP says you don't have symptoms, insist and insist and insist. And if he is not doing that, say, look, I want a second opinion. I want to see a specialist. It is your right to do that. So wives, please, when you begin to notice your husband, 10 years ago never got up at night to go and pee, but now he's getting up 2 or 3 times, he's beginning to have prostate symptoms.
That's right.
Urge him to go and check,
See,
go to the GP and get checked. And
right.
it is so important, even if they don't want to go, pay. An average consultation in the UK is 200 to 300 pounds. Pay for that, at least to talk to somebody.
That's
Go
true.
and do that. It's very, very important because it may well be prostate cancer. There is no difference initially between the symptoms of prostate cancer and simple benign enlargement to the prostate. They are exactly the same to start with. So if you notice we are going on a journey, your husband is stopping here and there to go and pee, please push him to go and see a GP or pay to go and see a specialist.
Thank you, sir. Thank you. Very, very informative. We are blessed tonight. Sir, now I want to the issue of this low sexual libido. When a man or a woman is not interested in sex, what will you say? What will you say to that, sir? Low sexual
Okay.
libido in men and
There
women.
are physical problems and there are psychological problems.
Okay, sir.
Let me just go to psychological. And by psychological, a lot of that is relational.
Hmm.
You hear people say, I'm no more in love. What does that mean? So when you are no more in love, you don't want to have sex.
Hmm.
So that is a relational issue. Hopefully something should have been sorted out before you get to that.
Hmm. Hmm.
Okay, you just don't want to have sex. But also, there are other things,
Okay.
very tired, stress, life events, so many things that will just put you off sex because somebody has just died. Okay.
Hmm.
And sometimes even environmental things, which even loving couples need to be careful about. What is the environment? What is your accommodation like?
Hmm.
You see, when your children are 4 or 5 years old, yeah, they sleep like babies. But when they're teenagers and they're up all night, you have to keep saying, be careful. You can't do things. And because you think people might hear, especially if your sex is very vigorous, that might put one person or the other person off. That's what I mean by the environment where you are. Have you got visitors? Are your in-laws in the house, for
So
example?
many things.
There's just so many things. So the
Yes.
condition has to be right. If you are very sensitive, you don't want. Even the temperature is too cold, it's too hot. There are just some things that can put you off sex. So a lot of habit things. And for men and women as well, even hygiene,
Hmm.
physical hygiene. Think about, your dressing, no, not your dressing, you're having your bath, you brush your teeth. Not all of us know that our breath smell. It can smell very bad. And your wife or you don't know about those things. And also genital hygiene for both men
Yes.
and female. You those things can just put you off. Life events. There are just
Yes.
so many things one can mention. Other physiological things, maybe we'll get to talk about that, but I might as well mention that for now. Low libido. Let me talk about women.
That's good.
A young woman find no issues with sex, right up to when you get pregnant.
Hmm.
When the woman is pregnant, hormones change, and
Hmm.
that can do all manner of things in your body. So
That's
people are fine and they have no problem and they can have sex until the day before the baby is born. That's fine with them, no issue. There are those who can't, who won't, because the hormones are now different. And there are those, if you have been unfortunate to have a miscarriage, you might just want to be very careful. You don't want to have sex just because of your past history. So
good.
hormone change during pregnancy, hormone change when you are breastfeeding the baby, and then the big one, hormone change that comes with menopause.
Hmm.
And this is where there has to be an expectation. Men to need to understand that all of this is because there's a change in hormone levels, different hormones, there can be a change in the desire in the woman and what you do about that. So
Hmm.
when you know going to be a problem, you are prepared. Your mind is set that, yes, my wife has just had a baby. Maybe this is not the right time. Maybe they had a bad cesarean. All sorts of things. They've had an episiotomy that is painful. There are just so
So
many things
many.
a man needs to consider. And when you actually consider these things, you are showing respect for your wife, and
That's
that binds you together even more than you are thinking about her, not just thinking about yourself only. So these things are very important. The hormonal change in the women, the expectation. You are on a journey, especially for a woman. The journey of life, the hormones are up and down, up and down, up and down. As the babies come, the babies, lactation and so on, and eventually with menopause, when that sets in, and then that has its own issues again that can lower libido in women.
oh.
Now let's talk about men.
Hmm.
The big issue about men is age. From your age of 40, every decade of your life, you lose 10% of your testosterone.
Wow.
Testosterone is the most important hormone, or so to speak, that gives you libido, okay, in men. Anything that reduces the quantity and quality of your testosterone will reduce your libido. So, both partners, I want you to be aware. Maybe you used to have sex 3 4 times a week or whatever it is. Now you're in your 50s, your 60s. That will go down on both sides for the reasons I've given for the woman, and also for the reasons I've given for the man. Chronic disease also reduces your libido.
Hmm.
And the number one chronic disease, which unfortunately is common among Black people ourselves, is diabetes,
Okay.
especially type 2 diabetes.
All right.
And a lot of things we mentioned today, you can always mention type 2 diabetes or diabetes. Whether it's premature ejaculation, delayed ejaculation,
Hmm.
you can implicate diabetes into that. So it's very important we are aware of that.
That's
90% of diabetes is type 2 diabetes, often due to overweight. So when there is type 2 diabetes in your family or so, begin to take the measures.
that's
The
right.
effects that diabetes causes on your erection, for example, starts 10 to 15 years before there's a clinical diagnosis.
Hmm.
So
Hmm.
if you're beginning to have for the first time erectile dysfunction now as a man, who knows, and you are say overweight, for example, and there's a family history of diabetes, in 10 to 15 years time, you are going to have clinical signs of diabetes.
Wonderful.
And 75% of men who have diabetes will have erectile dysfunction.
Ooh.
So it
Okay.
pays to look after your body, lose weight, exercise, good diet, get the right treatment. And
Hmm.
for the wives too, when you put food in front of your husband, I know we like to give our husband a lot of food,
Hmm.
but it may not be the best thing, please.
Don't kill your husband. Oh,
They don't overfeed your husband.
that's right. That's
Yeah, and it's a cultural thing. I remember years ago, some of my in-laws, my wife said, Gana no get body, that I wasn't fat. Why Gana no get body?
Can you
The idea
imagine that?
was my wife was being accused of not feeding me.
Hmm.
You know, it's not, that I know it's a cultural thing. It's
That's right.
something we like to be proud. And even our teenage children, when you see your teenage son with boobs, his testosterone is like 40% or 50% of what it should be. So he's beginning to accumulate problems even as a teenager.
Wonderful, wonderful.
I'll stop there for now.
Yes, sir. This is really deep wisdom. Wives, you can help your husband, especially concerning their diet. I've seen a situation where a man said the wife cannot control his diet, and I've seen another young lady said, I control what my husband eats. I said, how do you do that? She said, Mommy, if my husband falls sick, I'm going to be carrying him about, and I don't
Yes.
want that. And I
Mm,
said, that's deep for a young lady to have said that. So for men who believe, oh, your wife cannot control what you eat, your wife cannot, please, for your own sake, this
mm,
is necessary.
mm.
Health is wealth. Thank
Yes.
you very much, sir. Thank you. We are really blessed. I
Mm.
believe we please, can you appreciate doctor in the chat, and let's have more questions. But I still have questions here, sir.
Just keep coming. Keep
Yes,
coming.
sir. The issue, okay, from what you've just said now, it seems as if the low sexual libido is related to age. As you age, the
Yes.
desire get, and then, like you said, there are various reasons that a man or a woman could lose the desire for sex,
Yeah.
which could be psychological, medical, and all this. And I remember a case several years ago. As a counselor, I said we hear a lot of things. The wife was bereaved, and so because of that, she wasn't interested in sex. And do
Mm.
you know, that caused a lot of issue between the wife and the husband, because for years the husband just decided not to have anything to do with it. And when we asked, he said, when the wife's mom was when mom's wife was sick and eventually died, the woman was not really having sex with him. So, husband and wife need to understand one another. I need to know why is my wife losing interest in sex,
Mhm.
why is my husband losing interest in sex. It's a matter of coming together, understanding one another. And then you said something, sir, that you notice that it's only men that will come to the doctor. It's
Yes.
always good for husband and wife to go together, because
Mhm.
sex is about both of you. It's in
Yes.
the interest of both of you. So don't a woman should not go alone and complain to the doctor if it's a
Mm.
woman that is having the problem. The man should not go alone. Both of you should go together so that you can resolve it. Thank you so much. This is amazing.
You
Um,
see, when you go with your wife, you have the doctor there as a referee
you see, you see.
because there are things depending on the way the two of you relate. There are just some things you can't bring up the two of you at home.
Hmm.
You might get into a situation whereby a fight will just come out. Anything you say can bring a fight. So
Hmm.
you just quietly avoid that. But when this couple sat in front of me and the wife said, I thought you were having an affair.
Hmm.
And I gave a short lecture of how common erectile dysfunction is. I was the referee. I had no interest. I was not supporting one person or the other.
Yeah,
I was stating the facts. That's it.
that's right. That's right.
I also had another situation whereby a man has got himself some Viagra and is doing okay now. They've not had sex like for 5 years.
Yes, you see,
And then at night now, he's now wanting to have sex.
you see.
The woman has closed that chapter 5 years ago.
Wow, 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 wow.
You see, that's how some men think. You can't suddenly not done something in 5 years. You've been looking for a solution. Now you've got it. You want to go. No, it's a team thing, not one man job. It's not. It's the two. And you can therefore imagine the wife was angry. I've
Hmm.
closed that chapter. We never talked about it. Now you come, the word used that you are prodding with a cucumber in my back.
Oh, thank you, doctor. Let's talk about low sperm count and infertility, sir.
Hmm.
I know there are several things that could cause that. Would you like to say one or two things about low sperm count for men? Because people battling with infertility, at times, it has to do, it might be the man, it might be the woman. But what do you want to say about this issue of
Okay.
low sperm
First of
count?
all, to define infertility, you have been trying for at least 12 months.
That's right.
So unprotected sexual intercourse for a year before
Mm,
you can say there is a problem.
mm,
There's also what you call primary infertility. It hasn't happened,
mm.
at all. And also what you call secondary infertility. Maybe you have one child, two children, but nothing else is happening
Okay.
going forward. Let me talk about some of the anatomical problems that might have been responsible, especially for primary. There might have been problems with the testes, like infection with mumps.
Hmm.
Mumps are quite dangerous, really. So if your teenage son or anyone complains about swelling and pain in the testes, it needs to be seen very quickly. There's also what we call torsion of the testes. When it is twisted, it needs quick surgery in the hospital. Any pain in the testes in a teenage or a young adult, you need to get to A&E as soon as possible to get
Hmm.
that sorted.
All right.
Any previous surgery in that area may well have damaged some of the tubes.
Okay.
You know,
Okay.
hernia repair on both sides, something has happened during the hernia repair and things like that. The other thing is sexually transmitted disease, chlamydia, gonorrhea.
Hmm.
These things block your vas. The tubes that bring sperm out from the testes can be completely blocked.
Hmm.
And you get exospermia, zero sperm or very, very reduced quantity of sperm. Another area is drug abuse. And this is now becoming more and more common. Young men are now going to the gym. If you go to any gym these days, a young man will be offered anabolic steroids.
Wow.
When you go there, you see hunks. You've come there as a young man, you want to have a body like that. Boys are now more into body image than ever before. So
Hmm.
the temptation is high to now begin to take anabolic steroids. And what it does, when you take excess now, it just suppresses your testes. The testes get smaller and therefore does not produce any sperm or very, very little spermatozoa. And
Okay.
other diseases, again, diabetes, for example, can just damage things.
Hmm.
Diabetes also can cause what we call neuropathy. It damages the nerve, it damages the blood vessels. Those two things it does, unfortunately.
Hmm.
When it damages the prostate area, you might get what we call retrograde or dry ejaculation.
Hmm.
So when you have sex, everything is lost backwards into the urine in the bladder.
Okay.
Nothing is
So
coming
so
out.
no ejaculation. Nothing will be.
Nothing comes out.
Hmm. Hmm.
So these are like the anatomical things that can block that. And then other, marijuana, cocaine, and all of these things too can affect sperm production. Low, low testosterone from whatever is causing low testosterone can also cause low semen. Then there are congenital problems. Some people are born with abnormalities of their chromosomes. XXY chromosome, for example, are infertile. So things like that, we have what you call the mosaic. It's mixed up. The chromosomes are mixed up. We have things like Klinefelter syndrome. So there are congenital things to do with your chromosomes that can lead to these as well.
Okay.
Yeah.
Thank you so much, sir. This is amazing.
Mhm.
This is we are blessed tonight. We are blessed. I still have questions, but our time is ticking.
Yeah, let's
Sir,
go. Let's go.
yeah, I think you've answered. What lifestyle habits reduce spam? What lifestyle habits reduce spam?
Drug abuse.
Okay. Okay.
The number one will be steroid abuse.
Okay. Sorry. There's another one about it. Okay. How does heat exposure, e.g., tight boxer,
Yes,
hot bath affect
exactly.
spam?
It
Does it
does.
affect?
It does because I mentioned earlier on that these testicles are hanging outside for a reason, to
Okay.
have a temperature 1 to 2 degrees lower than your core temperature.
Wow.
So some men just like hot baths all the time, lying in the hot bath. That's not a good idea.
Do you know I want the question I will have asked you, because I had a case recently of a guy who went for, they were doing fertility treatment, and
Yeah,
the man, when they took the sperm, the first one was okay. The doctor said was okay. So they were now dealing with the wife.
yeah,
Only for the when they asked the man to bring the second specimen, they said the sperm was nothing to write home about. So it was like even the doctor said she was amazed. Why would the sperm, the first one they took was okay and the second one? So this could this be the reason?
No,
It
no,
What
no.
could have been the reason for that?
Okay. To produce, we normally say don't have sex for 2 to 3 days to bring
Okay.
the sample in. It takes like 3 months from initial production to complete mature, have a complete matured sperm. 3 months, the same as a red blood cells lifespan. So if a man has, if a man, if you abstain from sex 2 3 days and
Okay.
you produce one today, that's fine.
Okay.
But if you have sex tonight and
Mm-hmm.
then you produce one tomorrow, it may not be okay.
Okay. So
And
it
that's
might.
why that's why there's instruction. Don't have sex for at least 48, maybe 72 hours. So we know that this is a good quantity.
Wow, wow. Okay. Information is wonderful. Wonder because we were like, what happened? And we were almost spiritualizing it, sir. That
Mm.
could it be something that what could have happened? Why would the sperm be okay today and the next time? Okay, thank you very much, sir. Okay, how often should a couple we are not going to talk about that. How often should a couple engage in sex to maintain intimacy?
No,
Sir, let's
this is quite serious, honestly,
okay, okay.
because people have no idea.
All right, sir. All right. I'm
If you
just
ask a question, you get all sorts of numbers. Okay. The couple should have sex as often as both parties agree and are happy with.
that's right. Then at
That,
least okay.
that is it. A newly married person shouldn't have sex once a month. That's not right.
Hmm.
Okay. And I've known of couples where the man wants sex 3 times a day. That's not
Hmm.
right.
Hmm. Okay. So both are
So, as you have come together, this is what getting to know each other.
yes.
Like the Bible say, and the man knew his wife and all of
Hmm.
that. And there is something say, I'm getting to know you. Okay. So your libido, even as a female, may be higher than the man, or vice versa.
Mm-hmm.
And but gradually you begin to notice what is what. One person might want to be initiating sex more than the other, and so on. But gradually, hopefully, if you want a good relationship, you should meet in the halfway or somewhere.
That's right.
So some weeks, 3, 4 times if you like, some weeks, one or two, depending on what is going on. But look out for the satisfaction of the other partner,
That's
of your
right.
wife, of your husband, so that one person is not complaining. And if one person is complaining, there is an expectation that is not being met, and there is a reason for that.
Hmm.
Now, if you just had a baby 6 months old and you're washing and you got 2 other kids and you've tried to do some job, you might just be very tired. So
That's
those kind of things need to be taken into consideration. Do I need to help here? Do I need to do all sorts of things? So
that's
men can go, or women go to work, come back and expect sex tonight. And if, say, the wife has been on maternity leave, all day the baby has been crying and this and all of that and so on, and you are back, is doing the cooking and so on, you
mm,
cannot expect good sex.
that's right. Hmm.
So get to know your partner, talk about things. Honey, how was the day? Find out. Sometimes some wives might minimize it because culture says I should do everything as a wife.
Yes.
But
Yes.
you try and find out. What, do the dishes, clean the house, or things like that. You are, giving your wife some esteem, some respect, and that will make her want to please you as much as
Uh,
possible. So it comes to communication and relationship. What
yes.
is the number? The number that is, good for both of you. Twice a week, 3 times a week, 5 times a week, as long as that is what you agree on. Once a month is not good for a newly married couple. And if
Okay.
you've been married for 70 years, it's going to be hard to be doing it 3, 4, 5 times a week,
It does.
because it is a journey and
Yes.
a lot of things will change along the journey.
Oh, thank you, sir. I actually want to pick one of the word you said. When you said good sex, what would you describe as good sex? You said it, doctor. So
Okay.
when you say good sex,
Okay. So good sex where both parties are
yes,
satisfied.
that's right.
So the
That's
man has been able to ejaculate and the woman has had an orgasm.
thank you, sir. Can a marriage survive? I always ask this question. Can a marriage survive without sex? You know, I've had a case of a man who confided in me that for the past 15 years, this is real, 15 to, they are elderly couple, Christian, that for one reason or the other, the wife has deprived him for maybe 15. If I say 20 years, some people would think it's a story. It's real life.
Yeah.
For almost 20 years. And I said, why didn't you ask for counseling and all this thing?
Mm.
He said, and they are still together. Can marriage survive without sex? And I begin to wonder, if for one reason or the other, a wife or a man deprive the other partner, what would you advise? People are online now. These are real things that people don't want to talk about. So
Mm.
what should such partner do when one has said, okay, I'm not having sex with you again,
Well, to
and
see
they are
you,
still together?
first of all, it is abnormal. Can a marriage survive? Yes, it can survive. It's
Okay.
down to what is the expectation? What am I looking for? So there are people who say we stay together for the sake of the children and the grandchildren.
Hmm.
We
Hmm.
stay together. She cooks for me. She cleans the house. She does
Hmm.
this. She does, So there are some things. All right, you don't have sex, which is powerful, intimate, and all of that. We should have enhanced their relationship a lot more than it is, and both of them will feel a lot healthier about it. Physically, psychologically, and even spiritually, you feel better because you are connected. It's
Yes.
biblical to be connected in that way.
Hmm.
So that is wrong to have that situation,
Very
and
wrong.
they should have communicated because there is an issue which is
Yes.
unresolved, and
Exactly.
for a Christian couple that is not right.
At all.
Especially there may be an unforgiveness,
Hmm.
and we
Yes.
are not a people to carry unforgiveness. Maybe something was said a long time ago, something was done a long time ago, but in Christ everything can be forgiven.
That's
So
true.
those two people, needs to, maybe you want to speak, or speak to the wife. What is it? What happened? And something is likely to have happened on one occasion, on very many occasions. I'm not loved. I'm not esteemed. Something was said about me. I was belittled, or whatever. Something has happened,
Hmm.
but
So
all those things can be
you should,
forgiven, or at least understood. That's what I would say. It is not right in
yes,
a
sir.
Christian marriage for no reason. There are some reasons, medical health problems and so on. Sometimes just precludes you can't have sex. If there's erectile dysfunction, for example, female sexual dysfunction, for example, you must say, all right, let's close that chapter. Both of
Okay.
us agree on that. But this one, only one person has taken the
And it's not right. It's not
yeah,
right.
it's not
And
right.
it's and I, like I said, I wonder why they left it so long. I think people should speak out. This is why we are coming out to say this thing. And this thing is
Mm,
always between among Christians. Abuse
exactly.
is so much among Christians.
Mm,
God hates divorce. What will people say? What will these people say? I'm staying here, and yet one is hurting. We should look out for the good of each other.
mm.
Christians should not be selfish, because everyone will give account, even of our
Yes,
relationship. We just
yes.
don't want, it's not right to abuse one another. Everyone will give account on the judgment day. So for us
Hey,
Christians, let's look out for the good
the
of,
marriage life
yes, sir.
is used as an example of our relationship
Nothing
with
with
Jesus
Christ.
Christ. That's
Yes,
the epitome.
yes,
We are the bride of
yes.
Christ that is coming for us.
Mm.
And therefore, we are in families, husband and wife, to mimic that.
Yes.
He said in the beginning, this is how
Um,
God made it. And there's a blessing. There are just some who finds a good wife, the Bible says,
fine.
There are just so many things about relationship. I'm blessed, I'm blessed, I'm blessed. You are blessed. Both, so you are losing out.
Hmm.
You want to iron out. And if there are some differences sometimes, there can be differences that, all right, you prefer green, I prefer blue. No issues. You follow that football club, I'll follow that football club. All of those things will come to an end, but we are together, and the Lord intends that we be together forever. We may not necessarily, we're not twins, we're not clones, we will not agree on certain things. Even our sex life may not
Yes,
be perfect, but we'll do
but
our best. I want to put you first, and as much as you can put me first. And between
yes,
the two of us,
we should.
hopefully, majority of the time, we're able to satisfy each other. Some of the times we are not, but you do
Yes.
your best, and there's no malice. You're not hiding anything.
Jesus said, love one another as I've loved you. Sir,
Exactly.
one last question, because our time honestly is fast spent.
Mm.
I want you to talk about the issue of snoring.
Okay.
I've seen cases in the last 2 months where the issue of snoring has put couples apart.
Mm.
Even there was one that they went to the doctor, and the doctor said you can stay in separate room and all this. So can you say a word or two, because this is
Yes.
causing a lot of issues?
First of all, it is known. It's a pathological situation. It's not, and there is treatment.
That's right.
I just wanted to say there is treatment, but the treatment is kind of newish. So
Mm,
not every GP will be very, very familiar with that.
mm,
What you want is an ENT, ear, nose, and throat surgeon, who at least you can start from there. It may end up with you go to a respiratory physician, somebody interested in breathing issues.
mm,
But there is treatment. And one of the things you can begin to do yourself is, first of all, how do you lie down when you sleep?
mm,
Try sleeping on your side so your tongue is not falling to the back of your throat. Or
mm,
if you can, sleep on your front or almost on your front. And
mm,
those two things will be helpful.
mm, mm,
And lose weight. You will find that a good number of those who snore like that, a good number, not everyone, are overweight. So begin to look after your health by losing some weight. But
mm.
that things can be done for you by seek the help of an ENT surgeon. And again, in the UK, I know the NHS is free for everyone, but I say, hey, for the sake of yourself, your sanity, and everything, spend that 200 to 300 pounds for at least a consultation. Consultation, just talking about it, and that can lead you can come back into the NHS or whatever it is, tells you what to do. So it can be treated.
Thank you, sir. It can be treated, please, because we've seen cases where one snores, the other one cannot sleep, and it's causing
Yeah.
a lot of issues. My people perish because of lack of knowledge.
Mm.
It can be treated so that both of you will be able to sleep well and have good life,
Yeah.
good sound health. And
Mm.
I want Daddy to give us last word, but somebody has a question. Yeah, if you can answer in 1 minute, because I don't like taking time. What
It's
could have been
okay.
the cause of tighten vagina where the man finds it difficult to penetrate?
Okay. Vaginismus
Oh, yes.
is the word. It's a
Yeah.
vaginismus. And again, this is mainly psychological,
Mhm,
but also can be physical.
mm,
If there's a vaginal infection, that is anything that is causing pain.
mm,
But a lot of it is down to psychology. I know if somebody actually became pregnant, but wouldn't even allow doctors to examine
mm,
because they're very frightened of the pain. And some women, for example, don't like cervical smear because they can get that. They have sex, they've had children, and all of those things have happened. But to have that examination, the psychology of it just tightens everything up. So it's mainly that, and it's to perhaps sit with a counselor, a psychologist, to begin to find out why that is the case.
okay.
So yeah, it can be treated as well,
Thank you.
by counseling, by talking, by explaining the situation. You don't need surgery. There's no need for medication. There isn't any medication.
Thank you, thank you. I know it's like we shouldn't finish, but by the grace of God, I know God will give you the time, sir, to have time for us again. We are really privileged. We are really privileged to have somebody commented now. He said, "Let me quickly read that."
Yeah.
God bless you, Mama. Snoring has ruined a lot of marriages that I know. You see, so there's solution. The essence of all this teaching, this um, discussion is for us to know the right thing to do. We should not suffer in silence. And as Christian, we are the one that should enjoy our marriage best. So the issue of sex is causing a lot of things among Christians that nobody wants to talk about it. You don't talk about this in church. Nobody wants to talk about sex, but these are issues that couples are dealing with. I've seen couples who have not had sex in the last 10, 15 years, which should not be so. It's not
No.
because of any health issue. And doctor has explained a lot of things to us tonight. Please go to that YouTube. But anyway, I will be explaining that later. I want Daddy to give us the last parting word for couples here tonight. Those that are online.
Yes.
What will be your parting word, last word for us?
Okay.
Advice, counsel for husband
Okay.
and
Two
wife.
things. I've mentioned this, I would like to mention this. You are the number one custodian of your health.
That's right.
Your health depends on you. A lot of us are very knowledgeable. You know, when it comes to taking a loan, a mortgage, we know a lot about this kind of thing. We
Mm-hmm.
know the best schools around for our children to go and all sorts of things. We say we know the best churches for us to go to.
You see?
But sometimes when it comes to our own body, we leave it to someone else,
Wow.
especially men. No, you are the number one custodian. The Lord has given you enough brains to know, to understand, and how to improve this. And
Mm.
secondly, the Lord says, I want you to have life
Mm. The life,
and life to its fullness.
abundance life.
God wants you to have abundant life.
Mm.
I want to, but I can't do anything that much. God can.
Mm.
Cooperate with Him,
Mm.
and you can have an abundant life.
Mm.
I think there's a passage in the it's the Proverbs, I've forgotten. I say, be intoxicated with the breast of your
Right.
wife. I like that.
Mm.
Have eyes for your wife.
That's
It
right.
is a command. A lot of things that happen to us wrong, we don't pay attention. Our eyes begin to look left and right as someone else. No, he said, be intoxicated
Mm.
with the breast of, Bible doesn't mess, it doesn't mess about it. Be intoxicated. And the breast is not just the physical, it's the nearness.
Mm.
Like John says, he was the apostle next, very close to the Lord's breast.
Mm.
John
Yes.
say, so I was very close, be very, very close and intimate.
Mm.
The
Mm.
Lord has made you to enjoy the intimacy with your wife, with your husband,
Mm.
and he will help you when there is a problem.
Yes.
You are the number one custodian. God wants you to have abundant life.
Oh, thank you, thank you. We are really please. Appreciate that, doctor in the chat, please. If you are online and you have been blessed tonight, appreciate him in the chat. Thank you very much, sir.
And
I
sister,
hope we'll be privileged to have you before the end of the year. This is amazing. There's so many questions that, but we at least we've answered so many of them tonight,
yeah,
and a kind of burden have been lifted. I'm sure people online will agree with me. There are a
yeah,
lot of things you have taught us tonight, and
mm,
we'll work on that. Please, husband and wife, love one another, and like we said, look out for the good of each other. Don't
mm,
let us be selfish. Look out, everything has to be mutual between husband and wife. Thank
mm.
you so much, sir. Everyone is all, they are appreciating you now, and I pray that the Lord will keep you, sir, keep your family, uphold you. We are really blessed. We have been
Thank
tremendously
you.
blessed tonight. Thank you, doctor.
Okay, thank
And
you.
like I said, I hope before the end of the year you have you will be able to spare 1 hour again for us, daddy. I want thank you so much, sir.
Okay, thanks everyone, and I pray the Lord bless you all
Thank
in
you.
Jesus' name.
Thank you.
Amen.
Thank you. God bless you.
Thank
Please
you.
pray
Thank
for daddy. Thank you so much. We are grateful, everybody. The chat is full. Thank you for appreciating. Thank you so much. God bless you, sir.
Okay,
We
thank
are really grateful.
Yeah. Okay, thank you,
Thank
sister.
you. Thank you. Oh, we were blessed tonight. Thank you so much, sir. I believe you're all blessed. Please, if this is on our YouTube channel, you can share the link to others. I'm sure you agree with me. For those that did not join us at the beginning, it's been very impactful. I must tell you, I've learned a lot tonight. I've been blessed tonight. Check our YouTube channel if you have not subscribed to it. All these are there for us, please. And I want to leave us with this parting word in the scripture, because this is a Christian gathering. That's why I said we need to talk about this thing. The Bible illustrates marriage. Let me read it. Ephesians 5:32 is one of my favorite verses in the scripture. It said, this is a great mystery, but it is an illustration of the way Christ and the church are one. So again, I say, each man must love his wife as he loves himself, and the wife must respect her husband. Love one another as I've loved you. The reason why the Bible illustrates marriage, with Christ and the church, is that Would you ever see Christ abuse the church? Would you ever see Christ deprive the church? No. Christ laid down his life. That's sacrificial love. That's what husband and wife should have for one another. You know, most of the time, the question we ask about marriage, the issue we have is because it's an indication of our relationship with Christ. It's an indication because if you understand Christ's agape love, if you understand it and you have that revelation, you will love our spouse without stress. Most of the challenges we are facing will be able to overcome it. The Lord bless us in Jesus' name. It's a wonderful time. Check our YouTube channel, share the links to others. There are so many things to learn from what we have done tonight, and I pray that very soon we'll be able to bring Doctor back. Thank you very much for joining us tonight. God bless all. Thank you so much. God bless. God bless you.